Saints starting right tackle, Taliese Fuaga, who's dealing with patellar tendonitis, and that's going to be in his right leg. And keeping in mind, he is a right tackle. So the right leg is the leg that he's going to push off more. It's that outside leg. Now, Fuaga is listed as 4 pounds. So what I want to ask for the audience is, what is his weight due to his knee?
Well, you're going to figure that when he pushes off, if he's doing repetitive pushing, and of course, what's the average time of an NFL play? It's about 4.5, 5 seconds. A quarterback has to get the ball off some way in less than 3 seconds now in the current age. So he's not out there like a repetitive distance runner or whatever. He's also, as you said, 320 pounds. He's 6'6". Got to be carrying a significant amount of visceral fat. I can tell you in my programs, we use DEXA scans. It is the gold standard for body composition, bone, fat, skeletal muscle in a 4-compartment mix. The idea is and I wrote a book, I've written 7 books on wellness, but the one I'm talking about is Lose Your Love Handles. For a man to have a 40-inch waist and carry it into his 4th decade, into the ages of 40, he has a significant risk to type 2 diabetes. A woman, 35 inches or higher, measured at the belly button. You have predominantly 3 types of fat. Cutaneous, that's under the skin. You
Mhm.
have intramuscular, that's in, like you see a steak and you cook off the intermuscular fat. You have visceral abdominal fat, that is in the gut area behind the abdominal wall. And then the last one, which very rarely gets talked about, is ectopic, E-C-T-O-P-I-C fat. That's the fat that if your heart is here, the fatty is around it. I'm not talking about necessarily invading it. That's intramuscular. The heart is a muscle. This is around it. So this fat in the visceral abdominal area sends out inflammation signals. So you got to figure this 324-pound man is viscerally, abdominally fat. He may be class 1 obese, but you don't think about that in the NFL. And I've had many, many NFL O&D linemen. I've had multiple segments on HBO Real Sports with Brian Gumble. And at one point, after I had seen so many, looking at their lab studies, and remember, the physical given to the players is not a physical you want to live your life by. It's just a
Mhm.
physical to be with a team for a short period of time and move on. So the idea is already a man like that carrying excess visceral fat has already got an inflammatory cascade. In other words, anything, whether it be shoulder, elbows, knee, whatever, you get it, that inflammation is going to be magnified. Now, what Spencer called this is inflammation of the patella tendon. Well, that can be called a couple of things. Patellar tendonitis. The patella is the kneecap on top that glides. The knee is a closed compartment, and so it's sitting on top. When you get this irregular wearing underneath the kneecap, it's called patellachondromalacia. Nondescript pain around the patella is called patellar arthralgia. And going from an acute tendonitis to a chronic is called tendinopathy. So you've got a couple of things to understand on that. Number one of the biggest causes of this is tight hamstrings because it puts too much pressure on the tendon because the knee doesn't get out extended. It's always in flexion. So it's putting pressure here. The other thing on the side of the knee is called the VMO, the vastus medialis oblique. The VMO can atrophy, and that's going to cause the patella to shift. And it's also going to make the knee unstable in internal motion. So
Mm.
that also could be tied to, down the line, risk to ACL tear. And the idea is, if you look at the anatomical, here's my pelvis. If I tilt forward, remember the pelvis is part of a pulley and lever system, the hips, the quads, the hamstrings. So I tilt forward, the hamstrings insert up at the insertion at the butt called the ischial tuberosity, and it takes the hamstring and tightens it. So in other
Yeah.
words, my hamstrings got flexible, all of a sudden it's tightened.
So what you're describing right now is an anterior pelvic tilt, which is actually something that's common with people that sit at a desk for a very long time, as well as these athletes like an offensive lineman. One of the things that it makes it look like you have a bigger butt because your hips are hiked up in the back. And that's why an issue like that could lead to the hamstring stretching. A lot of people would say, you need to stretch out your hamstrings more, stretch out your hamstrings. That's not the case. It would actually be more required to strengthen them and strengthen and stabilize the pelvis. Because when you stabilize the pelvis, you can mobilize the hamstring and the hips.
I think the key point for your people that do fantasy, maybe not, I don't know about the gambling, although depending on, I had quite a few right tackles in the NFL, and for that quarterback, or left tackles, I should say, and right tackles, but for that right-handed quarterback going back, I had all pro tackles I've worked with, such as Lomas Brown, and he's protecting the quarterback's backside. That means the quarterback, if Lomas or someone like Lomas misses the block, then all of a sudden that quarterback's being hit from the back. That's going to drive him in the ground. He could separate his shoulder, concussion. So that's why typically he's the highest paid off, other than the center offensive
Yeah.
lineman. But I will tell you that this is an injury that, if it is chronic, the physical therapists, athletic trainers will manage this. They can do kinesiotaping. They can do all the icing. They can do iontophoresis. They can do laser treatment. They can do dry needling. There's just an array of weapons in the toolbox. But the key element is that they'll do pain management. So how much pain can this lineman take? They'll brace him. They could be giving him, and again, this is up to the team doc, a Toradol anti-inflammatory injection. They could be using cortisone. That's up to the doctors. They could be using a topical cortisone like Voltaren and rubbing it on, because the Voltaren can penetrate. There's a host of things, all done under medical supervision. And so, yes, this is a guy that can continue on, but remember, you let that patella tendon just stay inflamed. You wear under the kneecap, but you also put the patella tendon at risk for rupture. So that's where all the medical management comes in. Thank goodness the NFL has or the NFL teams have some great staff that take care of this.
Mhm. I mean, the thing to keep in mind is the Saints, they lost Ryan Ramczyk, who was their starting right tackle after last year, and he had the same thing for years. It was his right knee always being an issue, and he retired because of it. And it's something that offensive linemen are always going to deal with because they're always getting low, they're squatted in that position. Now, what you want to look at when it comes to your fantasy football output is Taliese Fuaga was actually not doing as well during the passing game as he did during the running game. So when you see that, that means Spencer Rattler's not going to have as much time to throw a deep ball. That's going to negatively affect Rashid Shaheed. Now, he did have a good game. He did have a touchdown against the 49ers, but I would expect Jawan Johnson to be the one that's going to continue to get the greater amount of targets at tight end for the Saints. So if you're looking for a fantasy person to pick up, Jawan Johnson is absolutely somebody for you to go get. And hopefully, Fuaga can manage this pain and play well, so that way Alvin Kamara can also get some more run in and get that run game going. That's the week 2 recap of all the injuries that are relevant in the NFL for your fantasy team. Stick tuned for next week when we recap week 3. And I'm Spencer, and it's my father Mackie, and this was the Injury Desk podcast.
See you next time.